This patient was referred to me 7 months ago for endodontic treatment of tooth number 18 and endodontic retreatment of tooth number 19. Okay, so take a look. 7 months ago, all right? So let's go ahead and talk about this case, revisit it, and I'll show you the 7 months post-op. This patient was referred to me for endodontic retreatment of tooth number 19. I mean, look at this. You can't even call it a root canal. Terrible. Look at the crown and all. Just terrible. I mean, look at it. It's just terrible. Retreatment of tooth number 19, and he had pain associated with the tooth, and you can see a periapical lucency there. And tooth number 18, root canal. And this is tooth number 18. Tooth number 18 had received a composite restoration 2 years prior, and tooth hurt to everything. And according to the patient, I found the tooth to be percussion palpation tender. Probings were 2 to 4 millimeters, and you can see a periapical lucency. So this was a necrotic tooth. Look at tooth number 19, and I was hoping that this was the root anatomy of the distal root, but in reality it wasn't. And you can see that this is not part of the distal root. This is just normal bone anatomy superimposed on the distal root, giving the impression that this is part of the distal root, but in reality it wasn't. And I'll show it to you. So we went over options with the patient. The patient has dental phobia, claustrophobia, and severe gag reflex. So we talked about IV sedation, of course, with doing root canal on tooth number 18, redoing the root canal on tooth number 19, or extract those teeth, and patient said that he wanted to try to save them. So today we IV sedated them and did both of these treatments in one visit. And here's the post-op. As you can see, everything went beautifully. Look at tooth number 18, 3 canal systems, proximity to inferior alveolar nerve canal. You need to be really careful with these. And look at tooth number 19. The dentist who had done the root canal had missed 2 canals. I mean, the root canal was terrible to begin with, but he also had missed 2 canals. The middle mesial canal he had missed, and a distal buccal canal he had missed. And of course, he wasn't patent at all. These were 25 millimeter long roots. And as you can see, everything went beautifully. I was able to regain patency in all 5 canals and 3 canals here. And as I said, this is not part of the distal root anatomy. Distal root ends right there, and you can see I have a sealer puff right there. And look at the mesial roots. Looks like all 3 join, and there's a sealer puff right there. Everything went beautifully. We temporized the tooth and referred the patient back to his dentist for the permanent restoration. And again, look at this PA, and you can see that the apical end terminus is right there. This is part of the normal bone anatomy superimposed on the distal root. And again, this x-ray confirms that. So, as I was saying, this right here is not part of the root, the distal root, right? So I explain all of that. So the distal root doesn't go like this. All right. Again, you can see the periapical lucency here and here and here. And this was immediately after we had done an RCT on tooth number 18, and we redid the root canal on tooth number 19, where there were a bunch of missed canals. And here it is. As you can see, that was almost 7 months ago when we worked on this patient. All right. But a lot of you were saying that this was part of the distal root, and the distal root indeed turned this way, curved this way. So a lot of you just had that opinion that I just made a mistake. This was part of the distal root. And some of you were saying that I should have gotten a CBCT and, you know, all of that stuff. And again, this was 7 months ago. Then this is the x-ray immediately after we had done our CT on tooth number 18 and redid the root canal on tooth number 19. And again, you can see the periapical lucency that was associated with the mesial root of tooth number 19 and the distal root of tooth number 19, and the periapical lucency associated with the roots of tooth number 18 right there. And again, that was the date 7 months ago. And this x-ray is the x-ray immediately after we completed our work and referred the patient back to his dentist for the permanent restoration of teeth number 18 and 19. And this was just now, today, 7 months post-op of teeth number 18 and 19. And here's the date. 7 months post-op of teeth number 18 and 19. The patient still has not restored these teeth permanently. Part of my cavity is missing out of tooth number 18. Part of the cavity is missing out of tooth number 19. Patient still has not restored these teeth. But look, the periapical lucencies have healed completely. And this was not part of the distal root, as I was saying, contrary to some of your beliefs that it was. Some of you did not believe me. And here is the 7 months post-op of teeth number 18 and 19. Periapical lucency associated with tooth number 18 is healed completely. Periapical lucencies associated with tooth number 19, they've healed completely. Let me show you a different angulation of these teeth so you can see better. This is another angulation for tooth number 19. And you can see that large periapical lucency that was here before has healed completely. And again, this was not part of the distal root. Distal root terminated right there. This was not part of the distal root. If it was, the periapical lucency would not have healed, because this canal here, the canal here, would have still maintained necrotic pulp tissue and microorganisms. But as you can see, as repeatedly said, this was not part of the distal root. This was bone anatomy in that area, and the distal root terminated here, and that's why the periapical lucency healed right there. This is another angulation, and you can see periapical lucency associated with tooth number 18 healed completely. Periapical lucency associated with tooth number 19 also healed completely. And again, this was not part of the distal root. The distal root did not turn like this. The distal root terminated right here, as I was saying, as I said many times in the original video. This is another angulation of tooth number 19. Again, you can see the periapical lucency associated with the mesial root is healed completely. The periapical lucency associated with the distal root healed completely. The distal root's terminus was right here, and this was not part of the distal root. All right, I hope you guys learned something. And the most important thing is, I hope you learned that I'm never wrong. Never, ever. Of course, I'm kidding, but yeah. So hopefully you guys learned your lesson. All right, so no need for a CBCT. I knew this was not part of the distal root, and contrary to what some of you were saying. All right, so I hope you learned your lesson.